Good afternoon, Mike. How are you doing?
Yeah, very well indeed. I mean, when you see the figure 10.1%, it sounds high, but in fact, it's actually higher, isn't it?
Well, different people will have different kind of inflation rates, Mike. So this is when you stick everything into the economy and gives you an average. And we've tipped over that 10% now when you're looking at the consumer price index. So how they measure it's a bit like what you just said there, Mike, but rather than just looking at, say, groceries, which people tend to buy on a weekly basis, so they know those prices are going up a bit more because they can see it. It'll put in things like your energy bills, your petrol costs. And, yeah, we've hit 10.1%, and about two-thirds of that, Mike, is about a quarter of it is due to the utility bills going up and our housing costs. About another fifth is transport. You lump in the food as well. That's three-quarters of the inflation. Now, the Bank of England, Mike, every month, last month they put up interest rates by 0.5%. What that does is tries to stifle demand in the economy. But I don't think people are trying to buy more food. They're going to the shop, seeing food prices going up. We're not trying to buy more kind of gas and electric. We're not trying to buy more road fuel. These are all supply-side shocks. So the Bank of England are hitting us again by increasing interest rates. The only benefit of doing that, obviously, Mike, is that if the US increases interest rates, we become uncompetitive with the dollar, so the imports of some of these products becomes kind of uncompetitive. So that's one reason you would increase. But, you know, things like Liz Truss could easily, or Rishi Sunak could easily cut VAT on domestic fuel, Mike, get rid of the green levies. That would actually act as that downward pressure on the high inflation that we've seen this morning.
Yeah, and that's the other problem, isn't it? Because we were hearing today from both camps that basically they're not going to do anything about inflation until September the 5th, when one of them becomes Prime Minister. I mean, that's 3 weeks away. Surely what the problem has been in this government is that ever since the beginning of the year, like since February, they've literally done nothing apart from take 5p off the price of the fuel duty, which was literally a non-event altogether. And yes, I know they've given some money away, but in terms of actually reducing the cost to people who have to buy fuel and for people who have to pay for electricity, they've done nothing.
Well, no, Mike, remember the cost of living is two things. It's obviously the cost of the things we're buying and the cost of government taxing us on these things as well. And so they can control that. I think we're heading into this kind of storm, I suppose, Mike. We think inflation's high now. You wait until we get to October and then January when the bills go up. They are going to go up even more. Now, this is where I think Keir Starmer, you know, I don't normally come on and say Keir Starmer come up with a half-decent idea, but what Keir Starmer is suggesting, Mike, is to keep the cap as it is. So what that means is then the bills that we get, they remain the same. And then they will top up the difference between what the suppliers have to pay. The other option of doing it is a bit like what Rishi Sunak had announced already is the bills go up and then the government pays part of our bills. Now, if you do Starmer's idea, you keep the bills down, that keeps inflation down. If you let the bills go up and then the government pays the bills, then that will increase inflation. Ultimately, it's going to cost the government pretty much the same thing. I suppose the one thing against Starmer's idea, Mike, for the autumn is that what you'll end up doing is if he pays for 29 billion for 6 months, this isn't going to fix itself in 6 months. We could be in this situation for years. And I think we were talking recently about the gas problems and the gas supply and relying on foreign gas as a problem. But I think there's some merit to it. But one of the things, Mike, is we know that about 20% of households in the UK can't afford these energy bills that are coming up in the autumn. They just don't have the disposable income. So is it right to subsidise or pay the higher gas prices for all the richer households who can afford it because it's not very targeted?
No, it really isn't. It's just a bit like the council tax. You know, the council tax rebate that they gave people, you know, affected some people, but some people who didn't need it got it, and some people who do need it didn't get it because they limited it to certain bands, didn't they? I mean, the other problem, of course, is that for people who have the ability to pay for stuff, that's all fine and dandy, but it's more and more people are falling into the category of people who can't afford to pay for things, aren't they?
Indeed, Mike. I think we had the labour market stats up from the ONS yesterday looking at wages. Now, the way we tend to think about wages, and you tend to get that annual pay award if you're working for somebody, where they might give you a 3 or 4 or 5%. The average wages are up about 5% at the moment. So you can see that's below inflation. So in real terms, so that's when you adjust the wages for inflation, we're seeing wages being cut, and they haven't grown much over the last 10 years. But if you think, if somebody's earning £100,000 a year and they get a 5% pay rise, that's £5,000. If you earn £10,000 a year, that's only £5,000. So I think businesses, government themselves need to be a bit smarter with pay awards, I think, rather than perhaps give a blanket 3, 4, 5, 6, 7, 8%, or whatever they're going to do to everybody. Should they be giving higher pay increases to those people at the bottom, which we know are struggling more with the cost of living crisis, and less to the top? Because, as I say, you earn more, you have a percentage increase, you're going to get a lot more pay rise than if you're earning less. That's the big critical thing. And the thing with the economy at the moment, Mike, is bumping along. But the labour market, I think Ian Collins was talking about this yesterday, there are lots of positive stories out there. The number of vacancies in the economy is 500,000 more than last year, so there's a good opportunity for people to be moving around. Unemployment's down, number of people on payrolls is up. So Liz Truss is talking that you can talk your way into a recession. And if you do doom and gloom, people think, oh, I better not spend money because there's a recession coming. If you talk your way into that, you will get one. I think we've got some turbulent times ahead with the inflation figures potentially, Mike, but there are some positive things out there in the economy as well.
Yeah, I think so. And what do you make of what Iceland are doing? They've been the first supermarket to announce that they're going to sell people food on credit. Some people think that's going to hurt the inflationary spiral even more.
Well, I suppose it will help families who perhaps can't get it, but they still have to pay at the end of the day, Mike. So if you're getting things on credit, you're not getting things free ultimately, are you? I think the government really needs to be targeting where the money goes, because if you've got these 20% of households that don't have the disposable income to pay the energy bills, and the bills rise, they're probably not going to pay them. Like there's this group saying cancel your direct debits or something in October, but it's not a case for a lot of people. It's not a case of them not wanting to pay. They can't pay. Helping people with food is obviously important, but the bills will keep creeping up because the energy crisis, Mike, this is embedded in for years now. We've sleptwalk our way into relying on foreign gas. We've reduced our domestic security of energy over the last 10 or 15 years. Part of this is to do with government since the 1980s. And the problem you've got there, Mike, is that this isn't going to be fixed overnight. We're going to be embedded with high energy costs for probably 5 to 6 years, the way things are going.
Yes. Let's talk about excess deaths, because it's always an interesting subject. You've been looking at some of the figures that have been coming out recently compared to the sort of COVID years. Tell us what you found.
Yeah, so let's start with just explaining what excess deaths are. So you can look at how many people are dying in a particular week of the year or total year overall, and then have a look at, well, how many people were dying in previous years. Now, we tend to cut out 2020 and 2021 when we're looking at these comparisons, Mike, because we did see the COVID pandemic kind of put a step change in all the figures. So they're a bit abnormal from what you would expect. So you can look at 2015 to 2019 and then compare what we're seeing now. And 2022, Mike's been a tale of two halves. The first half of the year, we were seeing deaths generally across the country below average for the time of year. And don't forget, we saw big rises in 2020, 2021, not unexpected, because people obviously who may have tragically died earlier on in the pandemic may have been dying now. So that was the first half of the year. Then week 15 hit. And what we've seen since then is the number of deaths above average creeping up and up and up. And they've been kind of running above average now for about 15, 16 weeks. And this is across a range of different age groups, because if we look at it by age group, we've got 10 to 14-year-olds, they're 11.7% above average. We've got 30 to 34-year-olds, 11% above average. 35 to 39-year-olds, they're 12.5% above average. You've got double-digit above average in the 55 to 59, 60 to 64-year-olds. The biggest increase above average, Mike, is the 75 to 79-year-olds. Now, one thing to treat with caution when you look at that figure is, with a large number of births after the Second World War, last couple of years, a large number of those have crept over into that 75 to 79 age group. So you've got more of them than what we had in the last, say, 5 or 6 years. So that's explaining it. But the Department of Health have been citing some reasons for this, Mike, saying circulatory diseases, which include heart issues and diabetes. So they could be some of the factors at play in terms of these excess deaths.
Yes, well, the people are a lot more unhealthy, aren't they, since before the pandemic, because they didn't get the treatment they should have got during the pandemic, because the NHS was basically shut down. I saw a report today that said that we can expect a lot more heart deaths or heart-related deaths because people simply haven't been getting themselves checked, and their hearts are now much worse off than they would have been if they'd been seen 2 years ago.
Indeed, Mike, I think one of the broadcasters has been covering this since day one, the lack of people coming forward. You know, when the government says stay home, protect the NHS, unless you've got COVID, you're probably staying home, protecting the NHS. And what that's meant is we've had all of this build-up. Now, where we are now, Mike, is we've got this kind of vicious storm of things that are going on, and it starts from the GPs right to care in the community. So I'll just quickly explain it. you're struggling to get a GP appointment. So people in A&E are saying, people are thinking, oh, I've given up trying to get a GP appointment, I'll rock up at A&E. That puts pressure on the A&E system. But we also know there's 13,000 patients now in hospital in England who are ready to leave. They're fit to discharge. They don't meet the criteria for staying in hospital. You can't discharge them because there's not care in the community. Now, the government sacked a load of care workers because they chose not to have the COVID vaccine. That's not a help there. And what we've got now, Mike, is A&E are seeing record waits, ambulance call-outs at kind of high levels as well. And you've got ambulances sat outside hospitals because the patient can't go into A&E, and patients in A&E can't be discharged, admitted more into the general hospital for care because you've got people blocking beds. And a lot of this is all to do with, government policy of lockdowns, the current care system's not adequate. We need a root and branch review from the start, Mike, because this starts with, if you can't see a GP, and you can't discharge patients in hospital, people will be dying in the middle because of all of it.
Absolutely right. But have no fear, though, because our old mate Tony Blair is sticking his nose in it again. I don't normally allow Tony Blair's Institute on this show, but since we're going to talk about him, he's calling for masks to come back. What's going on?
Yeah, so they issued some kind of report yesterday, Mike, talking about how the 3 months to save the NHS. I think, in 1990 to 2000, 2010, so we've got 3 months, according to the Tony Blair Institute, we've got 3 months to save the NHS. And what he's saying is that, and Jeremy Hunt's behind a bit of this as well, supporting some of this, is that they're calling on masks to be brought back in to try and stop the peak of COVID and flu this winter in kind of enclosed spaces and on public transport. We've had so many months or years now of the pandemic. The jury's completely out on masks, whether or not they work or not, especially the masks that people tend to wear, Mike. The more medical grade masks, yes. He's also calling for more money to go to the NHS. Put a tweet out this morning, Mike, another 75,000 job if you want a diversity and inclusion manager. Work from home in the NHS, closing dates the end of the month, more jobs on there. This is the money that we should be diverting to doctors and nurses. If you're going to save people and stop people dying, Mike, you don't need diversity and inclusion managers. You need doctors and nurses to tell you if you're okay or not. That's where we're going wrong.
And also, just ask Joe Biden how well those masks work. He's had COVID twice in the last couple of minutes, I think. Jamie Jenkins, thank you very much indeed. Independent statistician, of course, our man in Welsh Wales for the day. Excellent stuff from him.